the past few days now, we've been going over this thing called TeamSTEPPS, which is a MedCom-driven initiative that's actually been around for a number of years that they are currently reintroducing. It is a way to improve communication, effective communication in the OR to improve patient safety as well as improve patient outcomes.
So today we are going through some scenarios and practicing TeamSTEPPS and doing a brief before we do surgery, how things work during surgery, and then we're adding a post-brief to talk about how cases went and if there were any concerns, good and bad, for patients. So we did 2 scenarios today.
What's going on behind me here right now is a simulated OR case, simulating an ophthalmology case, a cataract removal. What we have done yesterday is we came up with a number of different scenarios across all different surgical specialties, general surgery, orthopedics, ENT, ophthalmology, and as well as OBGYN. And we put certain key triggers, things that you never want to have happen during a typical OR day, where whether it be problems with consents, mislabeled patients as far as like wrong site surgery. We've specifically built those into our scenarios for the specific reason to see that, you know, are our people catching them, and when they are they doing the right things in order to stop them?
We each have a role, obviously, in preparing the patient for surgery. We're going to pretend and act like it's like a normal day. We'll be starting here in a couple minutes, and we'll basically be starting our day like it's 0700.
In the OR, it is a team. The surgeon, I'm a little bit biased as a surgeon, but the surgeon is the leader. However, the surgeon has to listen to everyone around them. And this training is all about empowering everybody in the OR to speak up when they see something that is not right.
I think it's really important that you practice with your team because you do things in real life the way that you practice. And so if you're going into the operating room, operating on somebody for the first time, and you don't know the people that your support team is, it can make for some awkward interactions. And so especially when you implement new ways of doing things. And so if we're going to implement a new thing today, like doing a post-brief after every case, then we want to make sure that it's not something new on top of new on top of new. And so having the team that we can practice with and actually implementing when it's a real patient is the best way, in my opinion, to make sure things get done the same way every time.
I am a train-the-trainer, so I am responsible for ensuring that my entire staff knows all the tools of TeamSTEPPS. The cuss, the assertiveness, the advocacy. We ensure that we're doing our 2-challenge rule. I want to make sure that we all know all the tools in case we run into any encounters or problems. We can help each other with our communication, because without those, guess what? We're still going to have those same problems. And I also was able to implement our new debrief into our OR, because prior we weren't using a debrief. That was a struggle for us at this facility, but now that we have you guys' debrief, it is going to solve tremendous issues. We're able to filter it out to the prospective people that the debrief is going to go to. Like, let's say if I have an instrument issue, that's going to come directly to me. I'll push it out to Captain O'Brien, our SPD tech, OR nurse, and she's going to ensure that her SPD techs are on board. She's going to check the equipment. Things are going to start happening. Change is going to happen, so our patients are safer.
I think one of the values of adding a post-brief after every patient, whether it's a surgical encounter or a procedure, is that you can really take the time to give advice back to the support team and to the administration of the hospital to let them know active issues that we're having and ways that we think they could help, or safety concerns that might be brought up. I think it's also important to document near misses and things that might could have caused a problem, and that they didn't cause a problem this time. But if we catch them early, they might not cause a sentinel event or a catastrophic problem in the future.
None of us comes to work thinking we're going to get it wrong. I mean, you just need to look at national statistics, and unfortunately, we do get it wrong. And so some people would say, well, wait a minute, why are you doing this specialty training? Why are you doing simulation? Because that's really what it is. There are no real patients today. Don't you guys do this every single day? And you know, maybe some of the folks that are out there listening to this will say, gosh, do they really need to practice? Shouldn't they be practicing every day? Isn't that their profession? It absolutely is. But what we found is we mimic many of the things that we see on the outside. When a platoon of soldiers goes out to the field, they're not out there to defend the country against people in Tennessee or Kentucky. They're out there training. In many ways, they're doing simulation. When an airplane pilot first gets behind the wheel of an aircraft, he doesn't start by flying with 300 passengers in the back. He starts in a simulation area. And so what we've learned from other types of industry is, let's bring that here. Let's go ahead and use some of the techniques, some of the the elements that TeamSTEPPS teaches us to build on our clinical foundation.
The value taken from taking time out of our day is, I think it's hard to put into words. It's important if we take days like this once a year, every 6 months, to practice doing things. Because if we don't do these things, we have some awkward interactions that could have bad outcomes for patients. So doing this one time a year could save 1 or 2 sentinel problems that we could have prevented in the future. And I think that one day of having a little bit less clinic load in order to practice with your team is ultimately more important for those few patients that we save, whether it's a life or operation on the wrong site, or just the way we communicate and interact with each other to have a good patient outcome for every patient we see.
Everyone that is here is top-notch. The surgeons are phenomenal, the nurses are wonderful, the technicians are great, the support staff, many of the people don't ever get noticed. You know, everyone from logistics to the blood bank, to the lab, to supply, everyone has to get it right. So let's train when it's okay to make mistakes. Because if we make mistakes here, the worst thing that happens is at the end of the day when we do our after-action report, we say, you know, doctor, what if we did it this way? Or, Captain Jones, next time, what if we implement this if you have a challenge? Or Specialist Smith, you know, that was a great way that you challenged the doctor, but you sort of backed off at the end, and as you can see, there was devastating effects. What we want to do is we want to try to instill those elements into our paraprofessionals and our professionals so that when they are really doing live fires, which is what we do every single day, we're taking care of those patients, that they have no problems. They will say, you know what, I learned these techniques.
And I can unequivocally say, I've been here now for almost 2 years, that the level of communication that we have in our ORs is unparalleled. I can really say that in a lot of our rooms, actually in our general surgery rooms, that we have a very good core team of people who, from the tech all the way up to the anesthesiologist and the surgeon, I really feel as though there's a lot of back and forth, there's a lot of situational awareness, which is huge during the course of a case, because as a surgeon, I get hyper-focused on what I'm doing and trying to proceed along through this case. And I really feel as though with this training and as well as just with the core group of people that we have in this OR, we have outstanding communication. Where, I mean, things do happen during the course of a case, and when they get pointed out, we can easily forestall something that could cause a bad patient outcome in the future.
I like to empower my patients to let them know that your care is the most important to you as well as us, and if you have any concerns, we want you to address those concerns with us. You are an advocate for yourself as well as we are an advocate for you. Even the family members that are in same-day surgery, if they have any concerns, we address all their concerns as well. Because again, patient safety is our goal. My ultimate goal is when I put a patient on the table, when I talk to their family members, when I see a patient, I have to put myself in, this is my family member. So I'm thinking if this is my family member, I want them safe. I want them to have the best care, no medication errors, communication effective with the team, no gripe, no strife. If there's something wrong, that team is communication to ensure that they are all safe. And these tools that we've learned here today and yesterday and tomorrow, they're gonna get us there. We really appreciate the opportunity to get the word out, because if other facilities don't understand how good these tools are, they need to know.